I am Dr. Sridevi KN. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. If you are somebody who has bottom issues, if you don't know what is the difference between fissure and piles and anal cancer, and if you are wondering if you have any of these problems and how to get rid of it, then please stay tuned, as today we will be answering all your queries regarding your anal and rectal problems. I think at this present day and age, constipation has become something that is omnipresent. It could be any age, any gender, and that person will have suffered from constipation at one point or another in their lifetime. We have seen little children as young as 4 or 5 years old, and of course, elderly individuals in their late 90s, all of them having suffered from constipation at some point or the other. So when we say constipation, it could mean a number of things to a number of people. It is an extremely vague term. So for some people, constipation means that they have severe pain while passing stools. For some people, it means that they are not able to pass stools normally. Some people, hard stools. They have very hard stools and they think that that is constipation. And some other people, they may have some swelling or itching in the anal area, which again they feel is called constipation. So what exactly is constipation and how can we go about treating it? Before we treat it, we need to find out what is the cause of constipation. So when it comes to constipation broadly, there are two things which may be the problem here. So it may be either an issue with the movement of your intestine, where your intestine has become a little slow and the motions aren't getting removed from your intestine as rapidly as they should. Or it may be an exit problem, meaning that your intestines are working fine, but then just the exit, the rectum or the anal canal, there is some problem there which is causing the stools to be stacked up only in that area, and you're having problems with stools from that area. So that is how we broadly decide what type of constipation you have and how we can go about treating it. So if you have constipation, what are all the symptoms that you may be experiencing? So you may have hard stools, you may have a lot of straining while passing stools, you may have noticed some bleeding or swelling or painful swelling in that area, or you may have no pain or any bleeding there, but you may have a sensation that even after the passing of stools, you feel that there is something left behind. We'd call that as incomplete evacuation. So even though you have passed stools 2 or 3 times a day, you may feel that there is something left behind. You may feel that when you are passing stools, something is coming out of your rectum. And sometimes you may feel a little higher symptoms, meaning that you may feel some bloating or swelling in your entire abdomen, which is again known as constipation to some people. So once you have noticed that you have some of these problems, what should you do? The first thing you must do, or the first thing you probably do, is take some home remedies. So most people think that they will have a lot of water or they will have some fruits such as bananas or apples, and that will help them relieve their constipation. If that doesn't work, then they go to the local pharmacist. So if they go to the pharmacist and they ask for some creams or some syrups or some tablets which will help them pass the stools comfortably. So if the pharmacist doesn't work, then they try some other alternative form of medicine. They want to take some plants or herbs that they think, or some powders which will help them pass stools comfortably. And finally, if that doesn't work, they may end up going to an allopathic doctor, and that may not even be a surgeon. So the initial doctor that they visit could be a family physician, or in the case of some women, it could be the gynecologist, where again they are prescribed over-the-counter laxatives or stool softeners which they feel which will relieve them of the problem. So finally, when none of this works out is when the patient comes to a surgeon. So once you come to a surgeon, the true cause of your constipation can be determined. Whether you have a problem with the passage of your stools or whether it is a problem with just the exit of your stools. So there are various ways in which this can be determined, and it starts with a simple history. We have to ask you various questions regarding your diet, your exercise, your bowel habits, and a complete detailed history of all the symptoms you are experiencing to figure out what sort of a problem you have. And once we know what sort of a problem you have, or we have a tentative diagnosis in our head, then we decide to confirm it. So how do we confirm it? Is by performing tests. This starts with an examination. So we examine your rectal area, where we perform an examination. We use our finger and we examine your anal and rectal area. We also examine your abdomen and your general body to make sure that you have any other problems associated with the problem of constipation. Apart from that, when it comes to tests, we have a multitude of tests present at our disposal right now. So it starts with a simple proctoscopy or a camera examination of your anal canal, which can proceed up to a colonoscopy, which is the entire large intestine visualized by the camera. Apart from that, we have other sets of imaging such as CT scans, X-rays, MRIs, virtual colonoscopies. We also have different sort of pressure tests. So we have a test where we test the way you pass stools. There is an MRI for defecography. There is a MRI pelvis. There is a manometry where is a pressure study of your rectum. So there are a multitude of ways in which we can test you and your intestine to find out what exact problem you are facing. And then once we know what problem you have, then we can recommend what sort of treatment will suit you best. So for some patients, they may not need any treatment at all. What are the various treatments available? So if I talk about the treatment options, most patients will not require any treatment at all. They may just require subtle changes in their diet or lifestyle, which will help them get back on track. Some patients may require some sort of medical therapy, which may be in the form of creams or tablets or syrups, which will help in relieving the constipation. Some patients may require a little more invasive therapy. So they may require some enemas or suppositories, which is placed in the rectum itself, which will help them relieve them of their constipation. Very rarely, patients may require surgeries in order to relieve them of their constipation. So constipation, depending on the cause of your constipation, you may experience pain or discomfort in the anal area, or if it is generally due to a slow intestine, you may experience a dull sort of pain even in your abdomen, over your entire abdomen. So there is no easy formula for relieving constipation unless you know the cause. So there are plenty of home remedies. You must have noticed people claiming to cure constipation by drinking ghee water or by giving you some sort of natural laxatives, or to the extreme of people giving themselves soap water enemas and various sort of products inserted into the rectum in order to help you relieve you from constipation. But I think unless you have a clear diagnosis, so constipation is not a diagnosis, it is just a symptom. So unless you know what is causing your constipation or why you have to undergo treatment, I would advise that you do not take any home remedies. But once you have got a diagnosis, then yes, you can ask your surgeon for what sort of home remedies or natural exercises you can do to relieve yourself of constipation. So the treatment of constipation can be as simple as a change in the diet, or it may be as severe as requiring a major surgery in order to relieve you of the constipation. So a lot of other factors come into question. If a patient is passing gas but has not passed stools in over 7 days, so there are various things that have to be considered. So first of all, has the patient been eating properly? If you haven't been eating, then there definitely won't be any stool formation. Second thing is this a young patient? Is this an elderly patient? What are their normal stool habits like? Has this ever happened before? Is it normal for them to pass stools once in a week? Or is this seen in somebody who passes stools once or twice every day and all of a sudden they have not passed stools in 7 days? And also, have they undergone any procedure? Have they been under anesthesia? So there are multiple things to be considered before I can answer this question. So if you are somebody who has not passed stools in 7 days but you are passing gas, kindly go and consult a surgeon so they can figure out what exactly is the problem and how to treat it. Fecal impaction is one of the causes for constipation. It is commonly seen in elderly and bedridden patients where they are unable to walk around, they are unable to pass free bowel movements. So normally a human large intestine can hold stools for up to 7 to 10 days. But in the case of elderly bedridden patients, since the quantity of their food is also very little, they tend to consume very small meals and hence the quantity of their stools is also very low. Such patients may pass stools once in a week or even once in 10 days. And if this doesn't happen on a regular basis, the stools get collected in the rectum or the sigmoid of the large intestine and they can become very dry and hard. So when the stools become so dry and so hard, it almost feels like a stone, and then it becomes almost impossible for the intestine to push these stools out. So when this happens, this is known as fecal impaction. So how do we treat it? The most simplest way to treat this is to make the stool soft. So we make the stool soft by giving the patient proctoclytic enemas, and then once the stools are soft, if it is very hard stools, then the first thing to do in fact would be to remove the stools. So we call that as finger evacuation. So as much of the stools that we can, we remove it manually using our fingers, and once we feel that the rectum, which is usually over distended at this point, once we have removed the maximum amount of stools that we can using our fingers, then we will give them stool softeners such as an enema to soften the stools, and then probably give some sort of medicines to improve the movement in the colon called as prokinetics to make sure that the intestine can push the stools out.